Please join me in welcoming the Honorable Troy Fraser and the Honorable Susan King. Very nice to be with you both. I thought we might start with public education, if you don't mind. You've both had the opportunity this week to cast a vote on budgets in the Senate and the House, respectively. And in each case, Representative and Senator, you voted to put more money back into public education. There was a big cut to public education, as you know, during the last session. Controversial here, I'm sure, as it was elsewhere. Nobody wants to cut public education, but we had a budget shortfall. Is the fact that the Senate put $1.5 billion more into public ed, Senator Fraser, or that the House is proposing putting $2.5 billion back in, Representative King, an acknowledgement that you all cut public education too much last time and that you had to go back and make up for what you did? Representative first.
You could look at it that way, yes, because it was in excess of $5 billion. Was it a cut? Was it because we wanted to change and decrease the ability to educate students? I don't think so. As you just said, we had a huge budget shortfall. We did not have that this time. So we have put in $2.5 billion back. Does that mean we're replacing it? You could look at it that way, but some people would argue that we've had some efficiencies. There have been some changes. We had the stimulus package that was preceding that, which was one-time available revenue. So it's the most complex topic in the state, in my opinion, and it's the biggest expenditure. So I'm happy that we've done that. We may do more. No one knows at this point.
Senator, the Senate didn't put as much money back in as the House is proposing putting back in. Are you all going to rise to meet them, or do you think that what you all did will ultimately be what happens for the state?
Well, as you know, the budget is a process. All of you know that each side does a budget. They attack it a little differently. And I don't think there's any message there about the amount, the difference in the two amounts, because once they go to conference committee, they will come to an agreement. And I think probably the Senate number was probably a starting point. So I'm optimistic that the Senate probably will come on up to the House level, and hopefully my wish would be that they'd find a little more money and put a little more money in. And so it's a process that they're starting. And there's going to be things added to the budget.
Did you cut, Senator Fraser, public ed too much in the last session?
The answer is probably yes and no. My preference would have been I'd love to have funded more, but when I went to Austin, I think the people in this room sent me down to make sure that we live within our means. We didn't have the money in the budget to spend last time. I don't think they wanted me to raise their taxes, and so what we did is take the available money, divided it up the best we could, and we told the education community this is all the money we've got. We'll hopefully in 2 years the economy will be in better shape, and we'll try to improve on that, of which we are doing. So I think we did 2 years ago exactly what we had to do and what these voters sent Susan and I to Austin to do.
Representative, let me ask you about the question of money and public education. There are a lot of people who will tell you that money is not the only factor in making public education better. It's not just spending that makes public ed better. But there does seem to be a correlation between money and performance. By the TEA's own ratings of schools, the exemplary schools in this state spend about $1,000 per student more than the unacceptable schools. As you go down the list of ratings, exemplary to recognized to acceptable, acceptable to unacceptable, in each case they spend more, a little bit less, and the least. Should we be concerned about whether we're spending enough money per student, or is that not really where your focus is?
Well, I think it's a really good point, but the point being is it's all over the map what people think. I would say that perhaps we have exemplary schools where you don't have the expenditures. That may be the exception. But I think we have to have it on balance, looking at the money we spend. I think we're heavily looking at standardized tests. Is that the best way to measure student progress, the best way to look at success? And there's going to be a lot of legislation that addresses that. So I don't think we can say that money is the only answer, but I don't think we could be foolish enough to say that without proper revenue and expenditures that we can do a satisfactory thing. So I think it's all of, and I think in Texas, we have such a unique combination of students and people coming from all over the world that I think that it's very difficult to put a really finite point on what is the actual thing. I do think the money is important. I think quality teachers are important. And I think a fair testing scheme is important. At this time, I think the testing scheme has gone too far. And I think that will be in legislation that passes.
Senator, I looked up the Abilene School District's per student spending. The last available figures from the TEA, it's about $8,400 per student, all in, which happens to also be the state average. But right now, Texas is 49th among the 50 states and D.C. in per student spending. Only Arizona and Nevada spend less than we do per student. We're about $3,100 below the national average. Should the fact that we're now 49th, we were 41st, by the way, before the cuts of the last session, now we're 49th, should that be a cause of concern? Do those kinds of statistics matter to you? Does it tell you anything?
I'm going to go back to the question you just asked Representative King. I've been in the legislature a long time, and I've watched this process. I'm not one that thinks the amount of money you spend on the kids is near as important as the involvement of the community, the parents, the churches, and what's going on the local level, because I've seen a lot of schools, as you say, that don't have as much money, but you have a good community and you've got a good parent involvement, you've got good church involvement, and they tend to do a really an exceptional job at educating those kids. So sure we'd love to spend more money. You know, we're I guess looking at where we rank nationally doesn't drive me. I want to make sure we're doing a good job in the school districts we have, and I think Texas. You look at our results, we're turning out a good product, and I'm not one of the ones that think that throwing money at the problem is going to solve it. I think the parents, communities, churches are going to have a big part in how we educate our kids.
What about, Senator, this question of standardized testing that Representative King brings up correctly? It is a hot button right now at the legislature and all over Texas. Something like 86% of school boards statewide, representing 91% of students, or 4.4 million students, 86% of school boards in the state have passed resolutions against the current regimen of testing that our kids go through in the public schools. There does seem to be a move in the legislature. Nobody is defending the system, really. Everyone says we need to make a change. Where are you on this controversial issue? Where should the legislature end up on the testing question?
Before we start the session this year, I tried to hear from the locals, not only the superintendents, but the school boards and then the teachers also. And I came into the session believing that we had a broken system of testing, is that we were over-testing or teaching to the test. And we went into the session with me asking the Education Committee to reevaluate, look at where we are, and let's try to get it where we make sure we're knowing that they're accountable and we know that we're teaching, or the kids are learning. But 15, I think, is way too many.
15 is the current number of, it's accepted.
15 tests right now. I think the number that's being talked about currently is about 5. And
I think there's 5 in House Bill 5. I think other people are proposing maybe as many as 8, but no more than 8. So it's somewhere in the middle.
But the bottom line is 15, I think everyone agrees. To say we made a mistake on that, I think at the time, the people that implemented that thought it would work, but it has shown that it's not working, and we're recognizing that, and I think we're going to act accordingly. I would love to see them go back. I think 5 is the number in my mind.
It is. And Representative, you were president of the school board. You know, you understand where these school board members are coming from. They're hearing from their parents and their community that the kids are totally stressed out by the experience of being tested so much and having to prepare for those tests over the course of the year.
Well, I would agree with that, Evan, but not only just stressed out, and that's not a metric to stop what you're doing, but when you're talking about students that are almost acing the SAT or the ACT, you know, not even making a high percentage on the test, there's a disconnect. And, you know, there's questions about the vendor that has had this ongoing huge contract with the state of Texas. Why is Texas at 15? And others, you know, no one else in the country is even close to that. So I think it is prudent to stop and look at this. Yeah. There has even been discussion, well, you should take 12, but only 5 will count. Well, that seems like not a very good idea.
Are you also okay with Senator Fraser is essentially saying what House Bill 5 says?
Yeah,
5 tests, that's a good number?
I think that's reasonable. Yeah. I think that'll be the bill that's vetted throughout the legislature. I do.
Now, beyond testing, the other controversial public ed issue this session relates to choice. Mm-hmm. We started out the session by having conversation about vouchers. We seem to have moved off of vouchers in the most pure sense and more to a situation in which we want to give parents who have kids in low-performing schools the opportunity to move them to other schools. Now, where we end up, we don't yet know, but it's going to be somewhere along the continuum from simply open enrollment, maybe over here in public education, to more charters, to the possibility of some mechanism to give parents who have kids in low-performing schools money to send their kids to parochial or private schools. I'd like each of you to tell us where you stand, Representative King first, on this question of what the right place on that continuum is for school choice.
Well, I think you're correct. It is a continuum when we talk about school choice. And if you want engagement by the parents, you have to give them a little bit more of an input on what goes on with their students. That's the tip of the iceberg. So you have all the way from open enrollment, open transfer policies, people will be able to transfer within their district. And I think every district over the state is different on that. Yeah. You have specialty groups like maybe children with autism and these types of things that people have proposed having a voucher for. Far into the continuum, there's been business tax credits, all these different things that you hear about. The far end of the continuum is private school vouchers. I don't think this part of the state, and I don't support private school vouchers. I don't think that's the way we need to go. But I think you could do something incrementally to see how giving more school choice might work. I know with No Child Left Behind, you already have the choice to pull out your student if you believe like they're threatened, there's some kind of social thing against a child, bullying, whatever. But I think it would be foolish to try to implement a program like that, and I don't even know how we could afford it. It wouldn't even be feasible in this part of the state, private school vouchers, to look at some way that people would feel they had more choice. But quite frankly, I've always been told that you can't give too much school choice because it brings up the problem with recruiting in sports, but that's another topic. So
we could do a whole hour on that.
Yeah, that's another
that.
day.
That's right,
So at the far end, some choice, some looking at parent involvement, and then private school vouchers.
But
I don't think
you're not for vouchers in the
I am
sense
not
that
for
they've
private
been
school
said.
vouchers, no,
Senator,
I'm
what
not.
about you? This is a conversation that's been happening at some level in the Senate for some time, but Chairman Patrick has really brought it to the surface, hasn't he?
He has, the district that I represent has 824,000 people at the last time we did redistricting. Abilene is the largest of those cities. The rest of my district is very rural. The voucher program is not something I think that works in my district. I
would
don't
be opposed to vouchers as well?
I'm opposed to vouchers. I can't imagine a scenario where a bill coming forward that I would support because it just doesn't work in my district. And I think probably if I polled either the parents and or the school people, all of them are going to say that it's just not, vouchers would not benefit our part of Texas. So no, I'm not a proponent of it.
What about more charters? What Senator Patrick has moved to, and in fact he's revised this original plan downward on charters as well, that we're going to be able to add a certain number of charters a year to give parents more opportunities within the public school system over and above the traditional public schools. What do you think about that?
I'm watching the discussion. I'm not on the education committee, so unfortunately, a lot of what I see happening, I read in the paper here on the media. We talk about it on the floor some, but it's an ongoing discussion. Patrick appears to be pushing for more expansion, almost an unlimited expansion of charters. I don't think that I'm for that. Charter program in some areas, has worked, but it also I don't think I'm going to support a program where we just turn them loose. If they want to expand some, I'll listen to the debate, but
not unlimited.
Not unlimited, and they're going to have to prove to me that it's in the best interest of the state to go that direction.
Representative, one concern is that in the last session that we alluded to, the shortfall of the last session, the TEA budget was cut by 32%. There's some question as to whether the TEA has enough investigators on staff to even determine whether the charters we have now and any charters we would add are working properly. That might be some cause for concern in some cases.
I'd love to be able to quote how many FTEs they have now and how many they did. Quite a few. I don't know about that. Sometimes I'm a little skeptical of all the investigative arms that we have. That would not be my concern, quite frankly. I think all of our agencies could be tightened up a little bit more.
Do you worry, Representative, that if we just add a whole bunch more charters and don't have the means to determine whether the charters are doing a good job or a bad job, that would be a cause for concern?
Perhaps. I mean, my biggest concern with this is the student, first and foremost. How are they learning? How are they doing? What are they doing after they graduate from their charter school? Right. And quite frankly, we have a good one here in our district. And so if it becomes that the students are doing well, they're learning, they're going beyond high school, that's more of an issue for me. If there's an investigative arm, I think they can work it out with a bureaucracy that large. I think they can.
Let me move the conversation from public ed, which we could spend the whole time talking about this, to health care. I looked up what the impact of an expansion of Medicaid in this state would mean for each of your districts. Now, right now, this is not an active conversation because the governor has put his marker down and said we're not going to expand Medicaid no matter what anybody else does, and there doesn't seem to be enough support within the political class to buck him on that. It looks like that we're going to be an outlier among many of the big states on not expanding Medicaid. These are numbers that would go from 2014 to 2017. If we were to expand Medicaid, Senator Fraser, in your district, it would mean a total of $845 million in revenue coming into the district. You have $133 million or so in uncompensated care costs projected over those 4 years. Representative King, in your district, it's $226 million that would come in, federal, state, and local. You've got about $25 million in uncompensated care costs. It's hard to, I imagine it must be hard, principle notwithstanding, to leave that kind of money on the table, not see that money coming into your district. I wonder if you would talk about the calculus, Senator Fraser, you first, what it would mean if you expanded Medicaid, but the reasons that you think it would still be a bad thing for your district and for the state.
I'd have to say that I would disagree with your analogy. It's not a hard thing to leave that on the table because right now in Texas, 1/4 of our total budget, we're spending, I think the number's like $29 billion right now that we're spending, and it's growing quickly, and we really are not managing the system we have right now. Opening it up where you greatly expand that program could cripple us over the coming years. We look at, yes, they give us money for the first couple of years, but after that, and the money goes away, we're talking about somewhere between $28 to $38 billion of expense that we would be taking on over the next 10 years that the money's not there. And that type of expense actually could cripple the economy and the budget of the state. So
for you, it's not a hard call.
It is not a hard call at all.
Right.
I support the governor's position on this. I think he's exactly right. I've actually had conversations with a lot of the other states, my counterparts in the Senate in other states. And in Texas, I think it is absolutely the right call. We should not be expanding Obama's Medicaid program because as you read this morning, there's a compromise going on in in Congress potentially where they're going to carve back and take some of that money away that was intended. And if they want to send us a block grant, they give us the money. That's our money we send to them. If they'll give us our money back, let us manage Texas with our own money. Yes, we'll take the money back. But I don't want the federal government / Obama telling Texas how we have to manage our Medicaid.
Now, Senator, the statistics, well, you're welcome to applaud, that's fine. Senator, the statistics are these. We now have 6.2 million uninsured Texans. That's not counting the number who are underinsured, just uninsured. 28.8% of our population, far and away among the 50 states, we have the highest number and the highest percentage of our citizens who are uninsured. So let's say we don't expand Medicaid. What do we do to deal with what seems to be a very fast-growing population of people who don't have access to health care?
Back to me.
Back to you. What do you think? If we don't like Medicaid expansion,
the first
what
thing
do we
we've
do?
got to recognize, and I think everybody in this room recognizes that we've got a very unique population here. We have the largest border in the United States that joins Mexico, and we're serving a unique population. It's not an easy population to serve, is that it's easy to turn the debate to the people that are uninsured, but really what we've got to start doing is making sure we secure our borders, and we're making sure that the people that are here that we're taking care of that are it's an obligation that we should have. And I would love to have a system where we would be able to furnish free health care to everyone. But in Texas, I don't think that's practical, and I think that again, it's a Texas problem. We sent that money to Congress. If they will send us back our money as a block grant, we will figure out a way to manage it. But we don't like the federal government telling us what to do.
But you don't have a specific suggestion as to what we might do as a state to solve this problem. If we had the money back, do you have any ideas what we would do?
Well, since I'm not on the Finance Committee or on Health and Human, that would be the starting point. But the answer is that's our money. If they'll send it back to us in the form of block grants, we will start solving the problem. But as it is right now, that option's not available.
Representative, as a health professional, longtime health professional, you have a particular perspective on this issue. You know that when uninsured people go to the emergency room,
Yes.
it is the most expensive, least efficient form of care, and we all end up paying for it with our property tax. I mean, ultimately, there's a mechanism for all of us to bear the cost of the care of people who are not insured. So again, let me put the same question to you. Given the fact that we have 28, almost 29% of our population uninsured, what should we do? Are you with Senator Fraser and the governor on not expanding Medicaid? And in the absence of that, what should we do as a state?
Well, first I'll say that, yes, you're right. As a healthcare provider, I've seen the problems with Medicaid for years. To expand an existing program that's as cumbersome, which is already a decreasing access for patients because people, physicians, and other providers are not wanting to go into the system. The hospitals have no choice by federal law. They must take anyone that walks through the door. But I will tell you that to just carte blanche, go to the expansion, whereas it sounds like a nice thing, I think it is problematic for many of the reasons that Senator Fraser said. The federal government is not at this moment giving us flexibility to deal with it. We're very limited on cost sharing, which means people might pay a copay. We're very limited on the eligibility criteria. We have very little flexibility on who is covered. And I think because of this, it is such a huge sweeping program that people are used to it. It's a pure entitlement. And I did want to comment that I think to say money is on the table, that's not really accurate. That is a way, I think, that it's said to us, we're leaving the money, but it's a pure entitlement. So the money is only derived by the numbers of people that are eligible. We don't even know for sure the population of those who are eligible now that are not on the program. Some people choose not to go on Medicaid. I don't know what that number is.
But as you know, Representative, the estimates are what drive the
Yes.
monetary numbers, and the point is simply that we're being offered this money for, as Senator Fraser correctly says, a limited period of time to help us figure out how to deal with this problem. So in the absence of that, we're not taking the money.
That's correct.
And do we have the money in our own budget to deal with it in the absence of that is maybe a better way
Taking the
of
money
thinking the
based
question.
on if the people that are eligible apply for the program. The government's not going to come in and say, you're eligible, here's the money, we're giving it to Texas. That's not going to
Right.
happen.
Right.
The problem with that too, Evan, is the opt-in and opt-out clause. How does that work? Once you have given or had this Medicaid provided for people over 2 to 3 years, or whenever Texas would opt out, say that we went into the program,
Right.
how is that going to happen? You've already had this care provided for people. How is that going to work that you remove it from them? And so that's an option I've not heard anyone speak to.
Ask the same question of you I asked of Senator Fraser. Do you have an alternative scenario for how Texas fixes its healthcare system? You know, Senator Fraser and Representative King, you both know this. This isn't a Rick Perry problem. We were first among the states under George Bush. We were first among the states under Ann Richards. This problem's been going on for 20 years. It's a complicated problem. We have a fast-growing population, and as the senator says, the composition of the population is also a factor here. It's changing quickly. So what do we do in the absence of this?
All this is a very, very dicey thing, and I think, let me explain what the block grant is. I know you know, but the audience may not know. That's an amount of money that would be given to Texas to be able to use our flexibility, our ideas in trying to administer the Medicaid program. It's not just the mandates from the federal government. As you know, in the Affordable Care Act, Kathleen Sebelius is the Secretary of Health and Human. Her name is mentioned in excess of 70 times that she shall make the rules. We're still in an evolving process. I think that's part of the reticence here, that we don't know exactly what's going to happen. And I will say that physicians and others are going out of the system very quickly because of what's going on. I think there's a couple of things. One, and this is a very dicey thing to say, right now it is not ironclad how health care is provided for individuals who are not citizens of this country. Sometimes, and I've known this in our own practice, eventually you can become a permanent resident and you can qualify. So at such time when we can't even put our arms around how many people, I think it's a problem. I do think we have to have cost sharing at some point. Right. People have to contribute in some way. I disagree with the federal government giving Texas money to advertise free care. It is not free. Whether it be for SNAP, the food stamps program, or any other entitlement program. I think that we are so far over to the pendulum swing that it's like we have unlimited money to do everything. So in answer to you, I think we need to see more creativity. There needs to be more cash payments for people. It's not that they don't have access. They may not have access to health care that is going to be paid for by another entity. And so I'm pretty hardcore on this. I believe that when I see patients, I mean, I don't see them, I'm not an independent practitioner. I believe that people do care more about the services they are given if they contribute to it and they have this accountability piece. That sounds like a vague sort of pie in the sky idea, but I think it's true. And so I think it's very, very important. There's some penalties for hospitals now, that if people come in for just a cold after hours, that the hospital will be dinged for that. But by federal law, EMTALA, it's not going to change. They have problems too. Quite frankly, the physicians in Texas and the hospitals want the expansion. They want it because they know that they will lose money. And I'm not saying that that's a problem. I'm married to a physician.
Right, but you yourself are not for it.
I don't like the program. I don't like the way it's being controlled. And so I don't want to say on the right hand and left hand, we should all have one hand for that. And I'll sit on this hand. But I do think it's very, very important to look at both sides. The care, the cost, but what happens to the patient. And this is why it's such a difficult thing. And I think that Texas, we can't change that yet, because if we voted for it, wouldn't this happen, Troy? If we voted for it, the governor could veto it. So I've heard the governor say—
The governor's been pretty clear that if you all somehow decided to support expansion, he would veto it.
That's correct. But if there was more flexibility that emerges in the next 2 months or so, I'm not saying 100%, I can't speak for him, perhaps Senator Fraser could. I think there's some flexibility there if it were given. But as we know, the federal government is always not putting Texas on their top list of their pet student, if you will.
Well, I think the feeling is mutual. I think Texas doesn't love the federal government doesn't love Texas. I think we're locked in a death embrace right now.
Perhaps,
Yeah.
although I do have some friends here I know that are very favorable.
Senator, let me ask you about as chairman of Natural Resources again. Water has risen to the top of the list of agenda items, mostly because we're in crisis mode. We've come out of the worst one-year drought in the history of the state. We're almost back up to 100% of the state being covered by drought conditions right now. We have a $53 billion state water plan. You know this very well. It's up to this point been unfunded. There seems to be a move in the House and Senate to put about $2 billion in as a revolving loan fund to jumpstart the state water plan. Can you talk about why you think that's a good idea, and whether, given the magnitude of the problem, that will be enough to get us where we need to be?
Evan, I think you recognize the fact that I was born in this community, and I was raised with water being our way of life. Is that our house was in the middle of a cotton field, and you spend half the day looking up to see if any clouds are forming. It's just water out here, we understand how important it is, and the fact that we're in the middle of, we think we're probably in the third year of maybe a 10-year drought. This is the bad news is we may not have seen the bad yet, and because of that, I think it's raised the level of people paying attention, and it's become the perfect opportunity for me to try to fund a statewide water plan to put an infrastructure in place for the next 50 years. And I went to the governor this last summer, and me, myself, and others laid out a plan that said we would like a one-time infusion from the rainy day fund. We would like to take $2 billion, move it into a fund that would be operated outside of the state budget. We're creating a fund called the SWIFT in order to allocate this money, but we think that we're going to put in place an infrastructure for building reservoirs, for looking at new water sources, to try to come up with new conservation measures. We're going to look at a lot of things like taking desalinization water, cleaning it up, start using it. We've got cities now that are starting to take their gray water, clean it up, and put it back into drinking water. So I think the timing is right. The bill that I've laid out is asked for $2 billion, and the way we're going to divide that up, I've carved out $200 million that has to go to rural areas, which I think is very important. I've carved out $200 million that has to go to either water conservation and or reuse, which would be desalinization, coming up with new water sources, and then the rest of the money would be intended for the larger projects like Cedar Ridge Reservoir that we're trying to build out here, that if we build that reservoir, I think it could guarantee West Texas a supply of water for a long time. It's a very, very forward-looking plan that this city is taking on, and I salute them for their efforts.
Now, Senator, you know that the way that the rainy day fund withdrawals are to work is that you have to get 2/3 of the members of the Senate and 2/3 of the members of the House to vote to take money out of the rainy day fund. It has to be a one-time expense, and you need those 2/3 vote. The legislature is not a very spendy place right now. And the Senate in particular is even more conservative, the body, the membership of the Senate is even more conservative this time with the people who left replaced by the people who came in than it was last time. Do you think it's a foregone conclusion you have the 2/3 to get that money out of the rainy day fund?
All I can gauge is the reaction when I laid out the bill, the reaction of the Finance Committee when I laid out the bill, and in my communication with the other 31. I'm yet to have the first person to tell me that this is a bad idea.
So no one has come to you and said, I oppose this because although I support fixing the water problem, I don't want to spend money out of the rainy day fund.
I guess the term I would use, I'm cautiously optimistic.
Cautiously optimistic.
Is that everyone recognizes this is not spending money. This is money we've had setting in a fund, and all we're doing is moving the money over here. We're not going to give that money away. We're going to make it available for communities to borrow that money. The way this will work in Abilene is that part of this money we'll use as bridge financing to help them get the project started, help paying for engineering, the cost before they can start actually damming it up, get water, and start selling water. But the big funding for the project will come from being able to bond that. We'll get them a very favorable rate. The state of Texas has a great rate that we can get. We'll probably discount that to this community, but once they start selling water, they're going to pay it back. It'll go back into the fund, so that we're going to regenerate that money. We're going to lend it. They'll pay it back. We'll loan it to someone else. They'll pay it back. So this money is a jump start fund to encourage communities like this to help them solve their water
And
needs.
again, no opposition that you're aware of so far.
I'm yet to have the first person either in the House or the Senate tell me that this is not a good idea, including the governor.
Now, Representative, you know that from last session, there was opposition to taking money out of the rainy day fund to maybe buy back some of the public education cuts. There's discussion of the water withdrawal. There's a possibility of a transportation withdrawal. And there were some Democrats who've said, if you're going to ask us to vote for a withdrawal for water and transportation, we're going to sit on our hands unless you let us take money out for education this time. Help us understand the politics of the House. Are the 2/3 vote that you need in the House there, do you think?
Of course, we have 150 people, which makes it a little bit difficult. Of course, Senator Fraser was in the House. He knows. I compare the House to a Wild West event, and they're kind of like the East Coast. They're very dignified. They all have their own mics. Our group is a little different.
It's like the House of Lords and the House of Commons, right?
I would agree. So let me just say, nothing trumps water. Not healthcare, not education, not anything. We all know that. That's an obvious lesson. I cannot imagine anyone opposing it, but that, for me to speak for 150 members would be ludicrous. So, you hear different things, and it's not so much the water that we all understand the drought, we understand that, but people do fight about the mechanisms and the reservoirs and whose water will be diverted. There's a lot of people who think that the cities will come in with a big straw and take our water. So I've not heard opposition, but if it just flew through, I'd be surprised, but I totally support it.
You're a yes vote for sure.
Absolutely, but I'm a realist too. But you are correct in the comments about transportation and education, and I would not put it past anyone to play the back and forth with those pieces, because as you know, last session the rainy day fund was sacrosanct. There was not any discussion of anything being removed. I think it's quite different this time. And I do support Senator Fraser's leadership on that, and yes, I support the $2 billion. And I've read the whole water plan. Have you?
I have. I would not describe it as light reading.
It is not, and so it makes the case, and it's different all over the state. So I think it's time that we step up and do something. I do.
All right, we're going to stop our part of the conversation here. Let's give a hand to our elected officials up on stage with us.